Hi everyone, this is Business Insider. You're with Sriram Iyer, and we are here back again with the fourth episode of the Big Reset. All you need to win in the post-COVID world, where we put the spotlight on all the steps that are required to be taken to come out of this crisis and come out of it with as minimal a damage as possible. And in this is a special initiative that Business Insider has undertaken in partnership with Observer Research Foundation, one of the foremost think tanks in India, a set of people that the government, the policymakers, as well as each one of us can ignore at our own peril. And today, joining us from ORF is Dr. Sanjay Joshi, the chairman of ORF, and we have a very special guest today in Mr. Naveen Jindal, an industrialist and a former parliamentarian. Thank you, Mr. Jindal, for joining us, as well as Dr. Marcus Rane, our in-house health expert, who's from Thrive Global, who will put the spotlight on the finer details of what we are going to discuss. Let me bring the topic to the table first, which is that the Indian economy has to reopen again, but how fast is too fast, and how slow is too slow. And whatever we do in these next few days will have an implication for the economy, and that the larger impact will be visible later. Each individual life will be affected before, unlike in the usual scheme of things where it trickles down from top to bottom. And therefore, we want to ask our panel of experts. We are into the first week where some amount of relaxation has already taken effect since April 20th, and there are learnings, but the information is still flowing in a very sort of disparate manner. Not everyone has the bigger picture. The individual stories that are coming in from different parts of this country have to be put together to form the bigger picture, and that will guide policy making in the days to come. So let me go to Dr. Joshi first, our partner in this special initiative that we call the Big Reset. Thank you, Mr. Joshi. What do you think in the first week? What are we learning in terms of how this relaxation has played out? Are there signs of that require optimism, or some more caution as well?
Shriram, let us first understand that COVID has emerged out of left field like Godzilla, like that big monster all of a sudden, and smashed the mightiest into cowering submission. Okay. No one really knows what the way forward is. And if you look at what is happening globally also, you're finding that there are dissensions within countries. In the US, you have the spectacle of the federal government taking one position, the states taking another position, and that is replaying itself out in many, many countries. Now, that is where the whole point comes in, that when you start talking about a post-COVID world, my first point is that you are going to be in a COVID world for quite some time. The post-COVID world is still some way away. Yeah. And how you perform in the post-COVID world is going to depend. How India performs in the post-COVID world is to a very large extent going to depend, and critically depend, on how you are performing in the COVID world. So it is not that, shutdown was easy. It is you turn off a switch, and it is amazing how easy it was. You give a 4-hour notice and parts of the economy suddenly shut down. The point is, shutting down an engine is one part of it, but shutting down an economy, when you shut down a plant, Mr. Jindal would know, you have plant shutdown operations. Mm-hmm. Plant shutdown operations take time. An unplanned shutdown can be a catastrophe in an economy. See, parts of the engine seize. Parts of the engine cannot start again. There would be bankruptcies. There'd be lots of MSMEs which will go out of business. And the longer the lockdown lasts, the greater the pain becomes. And for a lot of sections of the economy, the longer it continues, the more difficult it gets for them to come back on track. So this is actually a genuine dilemma which is faced, that you cannot keep a lockdown forever, but restarting is not as simple as shutting it down. So there has to be a very, very calibrated response. Now, we tried calibrated responses. We did have a shutdown, then we started opening up. We said from 20th, we will start opening up parts. In some areas, you found you could not handle the response. Mm-hmm. And you again saw district administrations coming in with responses which started shutting down parts of the structure. Mm-hmm. Now, there needs to be far greater coordination, far greater management in this. As I said, how you manage this is going to be critical. What happens to you in the post-COVID world? So managing the COVID phase is going to be critical. How you're going to emerge out of it. Now we can discuss this in greater detail.
And for you, this transition period from the COVID world into the non-COVID world, and I want it to be as quick as a response as possible. How long is that period? 6 months, 1 year, or longer?
The jury is still out on that.
Okay.
Now, there are, everyone's talking about various kinds of recovery, whether it is a V-shaped recovery, after 1 quarter or 6 months, everything bounces back to normal. I don't think that is likely. In my view, that is not likely.
Okay.
Or you could have a second resurgence, possibly in fall, and the virus would be around to stay. The point is, the moment you start releasing lockdowns, and releasing a lockdown is a calculated risk. That risk will have to be taken. And that risk is not an easy risk to take. You would possibly see a spurt in cases. Point is, how does your health system then, is it ready? Have you during the lockdown prepared yourself sufficiently, A, by way of enhanced testing, to quickly contain areas where there could be a resurgence and effectively contain them so that all parts of the economy are not affected. Everyone is not affected. You see, your revival from now on, please understand one thing, is going to be a segmented revival. The entire economy is not going to open out. Parts of the economy will open out. It will not just be segmented by industry or by supply chains. It is also going to be segmented geographically. You will have reimposition of containment, quarantine regulations in certain other parts of cities, in certain other parts of districts or states, which again is going to disrupt supply chains. So there is going to be a lot of uncertainty in the days ahead. And managing that uncertainty is really going to require a lot of coordination, very, very clear communication between different hierarchies of the government, between the federal government, between the state governments, between the state governments and the district governments. That is going to be a difficult act. And we are seeing that it is going to be a difficult act.
Yes, so let me take that point to Mr. Jindal. In fact, what Mr. Joshi is sort of alluding to is what the statement that Anthony Fauci in the US also has made, part of the Trump administration. The lead physician there, he said that this is likely to come back. There's likely to be a second wave of coronavirus infections and subsequent deaths, etc. The unfortunate sequence of events that's likely to play out this year again. So, Mr. Jindal, how prepared are you for this? And do you still believe that, given the fact that there is going to be a second wave, let us assume that it's likely to happen, because we can never be, it's better to be safe than sorry. Still, do you hold that the Indian economy must be reopened in a hurry? And of course, that also means that, I'm sure you would agree that the reopening will come with its own safety measures that the government takes, as well as the ones that you will also have to take in the capacity as an industrialist.
Okay, Sriram, Dr. Joshi articulated all the issues really well. So I would just like to add that, we all have to learn to work with this situation. Say today also, just to give you an example, your own homes, our own homes, they are a small unit, right? Our homes are functioning. The kitchen in the house is functioning. We're cleaning the house. We are washing the clothes. So house is a very small unit. Then there are hospitals, whether it's All India Institute or whether it's Raman or Loya Hospital, hospitals that are also treating the COVID patients. They are also functioning, right? That's the worst example. That's the worst, the most challenging example that can be there. Then, luckily for us, say I'm talking about steel plants in Odisha, Chhattisgarh, Jharkhand. So by God's grace, those regions have not been impacted badly because of this COVID-19. So luckily for us, it's fine. And also, I guess we are also working in, it's much hotter over there. And so I feel that, and also a lot of people in the large steel plants or power plants, we have our own townships. The whole plant and the townships are one large campus. So we obviously are taking all the necessary precautions for safety of all the workers there. We're trying to maintain physical distances while working, while interacting with each other. Everyone is wearing a mask. So I feel we have to learn. I hope that in the near future, we find a cure, we find a vaccine for this virus, and we can all get that vaccine. Then we can forget about this. But till then, so we have to learn to work with these conditions prevailing, learn to take all the
And I think, Mr.
precautions
Jindal, I
and
think
keep
this is
working.
also, just to, sorry to interrupt there, I think this is not just for now. I think in the years to come, some of these mechanisms that you're going to put up in place for this coronavirus period is going to last much longer in the years to come, because this may be an opportunity to put in place systems and practices like, employee insurance, or working hours, social distancing, the kind of things that, and I'm not talking about you particularly, a kind of thing that the corporate India would have brushed aside as a socialistic advice a year ago. They have really no choice but to embrace them in the post COVID world. In your case, what would be the additional cost, for example, for implementing these safety measures for the long term in a steel plant, for example? How much does it push up the cost by?
I think the cost impact is negligible.
Okay.
These things do not cost very much. It's more of a behavioral aspect.
Mm-hmm.
Like whether it's sanitation, whether it's housekeeping, whether it's keeping. Say, it's just a matter of habit that earlier we would shake hands with everybody, and now rather than shaking hands, you just greet the other person from far away, or just say hi to them or something.
Mm-hmm.
So I think it's more about those kind of aspects. And as far as masks are concerned, or sanitizers, or washing your hands, so these things, I don't think the cost is much. And also it is going to have an impact, in the sense, like, say, definitely people where there a lot of people were working, we will try to do with lesser number of people.
Mm-hmm.
So and automatically some things just happen automatically. Now when all these things happen, we have been operating our plants with, say, 80%, 90% people. I mean, 10% people, they just stop. They don't want to come to work, or they are unable to come to work because their villages or the places that they come from, their people do not allow them. And then if you talk about cities, also, I mean, we have learned to work. I have never stayed in my house for so long, never ever stayed in my house for so long. So now when we stay in our homes and work, we see that productivity, whether we are interacting with our suppliers or customers or our own team, we feel actually we don't use, we so many times just insist on a physical meeting, on a personal meeting, but actually a lot of times it can be avoided. So which actually cuts down your costs, cuts down your travel time, cuts down your effort. So a lot of, I think we have to we have to see the silver lining in this, in this dark cloud. And I'm sure, and we are all learning a lot from this to in these situations, how to remain productive.
Kind of fast tracked us into the digital way of working for each one of us, I think, in every sector. And I want to come back to the question of employment and that, because that is probably the biggest part of the puzzle. But before that, I want to go to Marcus, Dr. Marcus Rane from Thrive Global. Marcus, the most important determining factor in how soon you can open up is essentially the health aspect. I mean, this is something where health and the data that is coming out on that front is the guiding principle and the criteria for opening up the economy or any other decision that we take in the next few weeks and days. What is the data showing right now? How effective has the lockdown been in curbing the spread of this infection? And the effectiveness, is it just something which is a mirage, or is it a real fact that India has kept the infections to the minimal, as people tend to believe?
Sure. Thank you, Shriram. So let me start with the good news. So the number of cases that we currently have in India are just north of 21,000. And we've had around 650 deaths from that overall. The modeling which was provided by the government a few days ago has given the indication that had the lockdown not started when it did, then that caseload number could easily have been up to 150 times the particular number it is now. And we've certainly seen that in terms of the trajectory of the doubling rate. It was around 3 days, every 3 days when it started. Now it's just about 10, 11 days in that region. And if you compare to Italy, for the same number of days from lockdown, they were roughly 1,000 cases, 1,000 times more than where we're at today. So we got to congratulate the government for their early action, their very decisive action, and putting in the, as Joy was saying, bringing that switch off very early on. But As I've mentioned previously on your show, and other political commentators have mentioned as well, there has been an asynchronicity in terms of the economic arm and the public health arm as well. And probably some of that has contributed to a little bit of the chaos that we have seen in India. Now, from what we understand in terms of the loosening, the model that India is looking at is a precision model where we identify the hotspots. So 3 colors have been identified: green, amber, and red. And you lock down the reds and you slowly start opening up the rest. We need to ensure that we protect rural India. So far, rural India has been spared significantly from the disease burden. And we need to ensure, therefore, that those that are present there are being provided with the right attention, both in terms of health, but also in terms of economic and other supportive measures as well. And then finally, of course, within the large metros, it's the urban slums that we need to have a lot of focus on. Now, I've seen policy reports that have come out that are talking about herd immunity being possibly reached in India by winter. A lot of commentators, particularly globally, have spoken about the efficacy of hydroxychloroquine, remdesivir, antiretrovirals, etc. But let me just say this. HIV as a disease, we have known and have begun to understand over the last few decades. Tuberculosis, we have known and understood over the last few centuries. Malaria, we've actually known about for a millennium. Novel coronavirus, which is the infectious agent behind COVID-19, is only 4.5 months old that we know of. So all the answers that we're trying to question, we don't even know if we're asking the right types of questions yet. Already we're seeing some case reports come out of China and other parts of APAC where patients who had tested positively previously and been treated and cured are now retesting positive again. So we know what the seroconversion journey of our immune system is.
Marcus, it's not just South Korea, it's also Singapore. We all lauded Singapore for the kind of efforts that they took, but it just turned out to be too soon to be calling a victory.
Absolutely, and they've now gone into lockdown till at least June the 1st. So whilst there are roughly 70 to 100 candidate vaccines out there which are currently going through testing, the reasonable expectation is at least 12 to 18 months. It is very reasonable to expect there to be a second surge. Yesterday, I was watching Dr. David Nabarro, who's the special envoy of the WHO to COVID-19, and he was talking about third surge, fourth surge, fifth surge possibly. And he ended actually with a very good comment. He said, we need to stop thinking in days and weeks and start to accept that the post-COVID or the new normal that we talk about is going to be months to years in duration.
Yeah. So it's probably going to, it's starting to sound like this is another diabetes, HIV or whatever. Obviously, irrespective of the fatality that is involved in it, it's something that we have to live with. And therefore, people have to be safe. People have to make this hygiene, sanitization, etc. part of their life and sort of add those extra 10-15 minutes to their day's work, in their own interest. But having said that, the question really is that, if it is going to stay with us for so long, for, months and years to come, if that's how long this process is going to take, then can you really afford to keep industries as well as employment generating, sort of economy running engines, shut for too long? Mr. Joshi, I think somebody, in one of the conversations earlier in these panels that we host, made an interesting phrase, used an interesting phrase that I want to bring it back. You can shut down the heart for a bit, but how long is it? And it has its own damage. Is that the case? Do you agree with that analogy?
Yeah, I would agree. See, I would put it differently. A lockdown is, if you're calling this a battle, a lockdown is a purely defensive strategy. You're willingly saying, I'm kind of living in a state of siege for a particular point of time. But definitely, once the enemy has broken your fortifications and you're seeing a resurgence of cases within communities, within localities in a very wide area, then obviously the response has to become more offensive. Okay. And the offensive response.
So the offense is, can we call it the stimulus? The stimulus that the government has announced, has it been effective, or do you want to see more?
Okay.
The economic stimulus.
Complete this fact about offensive and defensive strategies. For offensive strategy, you need to get into a process of very vast comprehensive testing with which we are still not ready.
Okay.
Our caseload, we are not sure whether it is low because we are not testing enough,
Yes.
or whether genuinely
Hmm.
it is low. So we need to get into more testing, and the zoning of areas only works if our testing is effective. So the lockdown period has to be used to ramp up these facilities. Otherwise, a lockdown loses its efficacy. You will have a situation where you have a lockdown and you still have a resurgence in cases. Now, we come into the stimulus packages. Governments all over the world have been throwing everything they have at it. Some of the countries have nuclear weapons that use nuclear weapons. $3 trillion of relief coming in from the United States of America. Every country does not have those kinds of nuclear weapons. Countries like India have to ultimately decide between three very separate sets of demands which are being made of them. The first is you have to upscale your health services, protect your health workers. You then have to ramp up testing. There's a huge investment which is going to be required there. A lot of spending is going to happen there. Then you have to take care of people, for example, migrant labor, people who are out of jobs. You have to A, feed them, B, put some money into their hands. That's the second kind of thing you have to do. Then a whole set of responses comes from industries which are affected, the MSME sector. Stimulus, how do you get credit lines flowing into them again? So a number of steps have been taken. You saw the announcements by the Reserve Bank of India to open the liquidity window. The problem is you can't fiddle around with repo rates, and they have done that. In a normal situation, that would start lending. In a normal situation, you are not in normal times. Banks are risk averse. They don't want to start lending. So they are more content to park their funds again with the Reserve Bank of India, no matter a 3.75% interest rate, that is safe, rather than lend to enterprises which they are going to see as risky. So they are going to need a far greater push to be able to want to start with this situation again. Then the third is states. At the front line of the battle of the states are fighting. The states are going to be making demands, legitimate demands, that they need to also to be given advances by far of whatever tax has to accrue to them. They need the money in their hands. The ways and means position needs to be improved. They need to be, their fiscal deficit targets need to be relaxed. So there are three competing sets of demands which are going to be made. And navigating this, yes, is going to be a challenge for the government. So let us see that they're trying to do all these three things at the same time. But let us admit they are going to be in a difficult position.
I think, and definitely it's going to be, a lot of conflicting requirements. One is going to come at the cost of the other, and that makes it for a very heated room, at least. Mr. Jindal, I think one of the points that he made about banks lending, not wanting to lend, I think it's essentially right now, the situation is such that everyone is kind of trying to defend what they have and not lose more in the process of trying to be a little more ambitious. But I think it is important to start sort of highlighting sectors, like everybody's been highlighting sectors that may not survive this crisis and probably companies that will die out in the process. But there are also sectors like yours, which was struggling before coronavirus because of cheap imports from China, Korea, Japan. And I think that is not going to be the case after once the dust settles. There is not going to be enough production there. There's not going to be enough imports. And I think steel making is one of those businesses that's probably going to be a slightly better area to invest in the months and years to come.
Yeah, I definitely feel so. And right now, I mean, we are obviously, we are exporting 80% of the steel that we are producing. And majority of that, it's quite ironic that majority of that is going to China.
Okay.
So we all the time we say that China has been dumping steel into India, but actually right now we are able to export to China. Obviously,
and this is after you mean after January or what is
no, after March.
After March. Okay.
Yes.
Okay.
Obviously, otherwise the domestic market is in 90% of the cases is better to sell. You get better price realization in the domestic market. But right now, because there is hardly any domestic market, there was hardly any domestic market. So we had to focus on exports. But now we are hoping that now with this opening up, slowly, because steel also then monsoons come. So people, if somebody was building their house or certain projects, so before monsoons, people like to complete a lot of their civil construction.
Mm-hmm.
So we hope that these kind of constructions will start. And if you are working in a campus, may that be a university or a factory or an airport or some highway, and you keep the workers, and that's what the government, the state governments, and the central government guidelines also say that. So I think if we follow all those precautions, I'm sure we will be able to, and then obviously there would
So
be
what
people.
has been the capacity utilization in the last 2 months?
The last 2 months, we've been able to work at around 75 to 80% capacity utilization
And
in
all of that
in
is
steel plants,
huh.
but the power plants are very low. Power plants, I would say, is around 40 to 50%.
Okay.
So power plant, because suddenly the power demand has also gone down. So, but then also I must say at this time, all the, whether it's the state government or the central government, they're all very forthcoming. They're all trying to help the industry. The banks, RBI has come out with so many sets of to increase the moratorium and everything. So all these factors, but I feel that the situation is just not a 2 month or a 3 month phenomena, but like Dr. Joshi said, it may be very prolonged. So for prolonged, so there, and especially MSME sector, they would need a lot more support. So, and we must support the Indian enterprise, because ultimately it would make good business sense to support them, to support the industry. After all, banks also are in the business of lending. So, and
what has been the response like? I mean, I know the RBI has announced a lot of measures, but are the banks responding? Have you been able to secure any long-term loan facility?
Okay, we are working on it. But in India, the banks are very risk averse for what all they have faced and what all they've gone through. But I think in this time, we all need to come together and help each other, support each other. If we do
I think one
support
of
each
the
other,
other responsibilities that I will sort of place at the doors of entrepreneurs and industrialists like you is the steps that you can take to make this economy viable, and aside from sort of relying on the government for money and tax breaks and incentives, is sort of trying to keep the jobs alive. And I think one of the sad parts that we have seen in the last 1 month is that even before the 21-day lockdown was over, companies of all sizes, and I'm not going to name any of them, but we've seen them all lay off people, contract workers, etc. And if that is really the economy that we have built, that it can't survive a 21-day sort of jolt, then we can't expect the MSMEs or the people who are running families to be able to survive this and sort of cooperate in the efforts that we have to take again in the days to come.
Sriram, I completely agree with you. We all have to be very, very supportive towards each other, and especially for the people, especially for the workers, contract workers, and everyone. We have to ensure whether there's migratory workers. So whoever was employing them, we should see that they are able to take care of those people. So that's why the work must start. And sometimes even the employer, there is no point blaming just the employer or the companies, because it may not be possible for them. We may expect them, that they should be able to do this, but maybe it's just not, they're not capable to do it. They do not have the means to support them, because some industries, the situation may be very, very challenging. So it's really the whole, that's why all these governments.
So our grouse here is, there is a recommendation that we as Business Insider had made a couple of weeks ago, which is basically like, when during the good times, the CEO salaries double, the promoter invests, more money into the company, and it's all fine. But the moment there is a sign of a crisis, the first thing to happen is a layoff, which is, I don't think, not a fair thing to do. But also it is difficult for, like you said, for not every business can actually sustain, because during bad times they end up looking at the cash flow. During good times they'll start looking at the price to equity ratio, so price to earnings ratio. So it's not, it's not. I think it's not fair. But so how do we beat this challenge? And I want each one of you to quickly chip in with a 30-second response on the recommendation that we made, which is basically to create a pool of funds, whether it is at a sectoral level, whether it is at a company level, and ask the government to sort of chip in, which is somewhat create a fund for payroll protection, and companies be given incentives for the amount of jobs. I mean, if they have the same number of employees, on July 1st as they had on March 1st, let them be given cheaper loans. Let them be given working capital, maybe zero interest loans. Maybe the government can chip in that form. That way, we are able to protect the incentivize companies who protect jobs. Would you like to sort of respond to that, Mr. Jindal, and then we can take a quick turn, each one of you?
So I think that's a very good suggestion, Sriram. And also, the banks, if they also start lending to the institute, to various companies and to MSME a little more liberally, not be very, very conservative, I think that would help. And nobody's asking for any haircuts. People just may need more time. And we have to have that confidence in ourselves that things will normalize. So if it is raining right now, sometime when if it's raining and raining a lot, raining cats and dogs, we think it's never going to stop. So it's like that. But, the rain does stop, the sun does shine. So this thing also, this COVID-19 also is not going to last forever. So it depends with the way we are all working with the cooperative endeavor and Government of India taking the lead, state governments working. So if we all work together, I'm sure we are going to be able to overcome this and we shall overcome these challenges. And again, so I think we just need to work systematically, have confidence, keep on helping each other, and we will overcome.
Mr. Joshi, do you want to come in on that payroll protection fund?
Your suggestion is good, but it's a suggestion which only works for the formal sector. Always remember that in India, 80% of employment, or even more than that, some say just 90% of employment is actually in the informal sector. Now, in the informal sector, many of these schemes cannot operate. So there you will require very, very different sets of proposals. You might even eventually have to think in terms of a Manrega kind of scheme, which operates for other areas, including urban areas.
So one of the thoughts there was that, instead of expecting the government to be able to take the stimulus to the last individual, if there is an industry body, for example, like a CM in automobiles, where the channel partners and the dealers and the distributors are struggling, the fund is created at the sectoral level, and they ensure that it's passed on to the right people, as opposed to sort of decentralize the stimulus and make sure that it works. I think in some form like that.
No, whatever is done has to be done in a decentralized manner. You will have to empower the establishments at the lower level, whether they are industry bodies, whether they are state governments or district administrations, who will need to take care of people in their jurisdiction. This cannot be a centrally administered scheme.
Exactly.
So it has to be done at a desegregated level. Most of the responses which are going to take place when you're countering a pandemic like this will have to come from the ground level. And you need to empower those people. That is important. You need to empower even your ground staff, so that they can take up these kinds of activities and work.
Great. Awesome.
Are a good idea for these kinds of sectors.
Also, I feel these kind of things may not be very practical, that we can't really expect the government to be paying for the wages of any company or even an MSME or something. So the best for the government is to restart the work, to restart infrastructure projects, to restart spending, and for the economic activity to start. So if the economic activity start, automatically these things will start. If they are like giving like tax breaks and everything, so that the economic engine that has to start.
No, that is definitely there.
Things are not very practical. Otherwise people start. So many other kind of things will start happening.
Yeah, I mean, we can. I mean, obviously, there will be people who will be working around these, measures that have been announced. The problem is that the employment. I mean, what are you incentivizing? The cheap loans and the tag breaks is not to line up their employers' pockets. It has to result in employment, and we are talking about a prolonged period of time where there are going to be segregated hotspots, right? Where you can't restart economic activity even if you want to, just like we said, right? I mean, and this hotspot can keep moving. So therefore, we need a mechanism to make sure that the money sort of keeps flowing, and the entire burden of implementing it is not on the government. And I'm sure this idea can be fine-tuned and sort of smoothened around the edges and made sure that it works for the unorganized sector, like Mr. Joshi mentioned. And with that, we're completely timed out. I'm sorry, but we have, more episodes of this big reset coming up. These kind of policies and the ideas that we are talking about that affect 1 billion plus people cannot possibly be summed up in 30 minutes. It is going to take a lot more discussion, debate, and deliberation. And that is what we promise to do between BI and ORF in the days to come. So stay tuned to both. Check out businessinsider.in. And I would like to apologize to Marcus for not being able to come back to him for one last question. I did have one more in my mind, but we are past the time that we had at our disposal today. But we will bring him back again in the next episode. So stay tuned to businessinsider.in and do check out ORF for all the latest research on COVID-19. Thank you, Mr. Jindal, for taking time out.
Thank you.
And we look forward to having you again on one of these panels.
Thanks, Sriram.
Discussing
Thank
the
you,
way
Mr. Joshi.
forward for India.
Thanks, Dr. Marcus.
Yes.
Thanks.